Nice.
Well, welcome everybody, and thank you for joining our first innovation workshop on Helix 2023. This session is hosted by EY, and the topic is how to experiment for the future. We've got 3 speakers today. We've got Raphael, Cara, and Ludovica. But before I hand over, I've just got a couple of housekeeping points. If you don't mind keeping your microphones on mute throughout the presentation, that would be great, unless the speakers have invited you. We have got closed captions enabled if required, and we are keen to make the session interactive and engaging, so please feel free to place any questions and comments in the chat box. Finally, this session is being recorded and will be available after the session. With that, I will hand you over, and I hope you enjoy.
Cool, thank you, Jazz. Can everyone see my screen? Is it visible? Just making sure. Yes, nice, sounds good. Yeah, also as Jazz mentioned, because I'm sharing my screen as like full screen, I can't see anyone, but please feel free to like jump off mute when we have a discussion, and also help me point to the chat. But yeah, really keen to have a discussion at some point in that session. We're supposed to have my colleague Cara, but whilst she is joining, just wanted to like give a little bit of intro to ourselves. So we're 3 women from EY, and particularly EY Seren. So I'm a service designer, Ludovica as well, and Cara, who's going to be joining, is our life sciences lead. And we're from a specific part of EY, which is Seren, which was basically a market research and design kind of agency that was bought over by EY a couple of years ago. And everything that we do is about helping often very large, complex and regulated organizations such as banks, government organizations, but also pharmaceutical companies to kind of optimize or reimagine their products and services. And we do that through human-centered design methods and tools. So I have a rich team of creatives, but also business designers, strategists, and innovators. So it's kind of a diverse team that we're in. So yeah, this is who we are in a nutshell. Before I go into the agenda and having a bit more of a part of that Cara wants to do, I'm just wondering, and I would like to have people put that in the chat, like why you sign up to that session. What are the expectations that you have? I think it'd be great to know before Cara joins.
Hi, Raph. I'm here. Yeah. You can't see me. I've been here the whole time. I know it's tricky when you're in full screen. Hi everyone. I'm Cara. I lead our life sciences sector for EY Seren, which is all about design and innovation and experience. We're extremely lucky. We work with all of the top global pharma companies, tackling challenges from how do we actually reimagine what clinical trials are going to look like in the future. How do we streamline and think about processes within a manufacturing setting, right through to, well, how do we actually improve the healthcare professional and patient experience by putting humans at the center? So we do a lot of different work across all areas of the sort of ecosystem within pharma, and we feel like human-centered design is such an interesting and powerful method in the life sciences and pharma space, because there's so many different interactions along the way and so many different kind of people to support along the way. So some of the other things that we're exploring is, well, how do we use AI as a tool to really exemplify and drive human experience to particularly in the essence of supporting a healthcare professional. We're also looking at a lot of different pricing strategies and how we connect value to a drug or commodity in terms of experiences and services that wrap around that, and what that means for pricing and going to market with certain drugs and medicines. So we're really looking at the whole ecosystem back and forth, and yeah, we've got some really exciting, I guess, scenarios, which I'm sure that you're all across, but really exciting scenarios to share with you all today to kind of push your thinking on a Monday morning. So lovely to be here with you.
Thank you, Kara. That was a great intro and like good overview of the channels we solve. I'll just go back to the agenda for today, just to give a bit of a heads up for what to expect for the session. So first, then Kara did that brilliantly. We had a bit of an introduction of like what we do within Seren and the kind of challenges that we solve specifically with pharmaceutical companies. Now I'm going to give you a bit of a whistle-stop tour of like how we think within our team, especially how, because we're for a big part designers, how designers think about the future. I think what binds us here together today is that we've all in some sort of way been approaching innovation, whether it's creating a new research project, whether you're part of a startup and creating new product and services. Innovation for us is our bread and butter. This is what we do every day. And part of it when we imagine product and services is about understand the future a little bit better and like bring it to life. So I'll talk a little bit about that. And then we'll spend most of the rest of the session, as Kara mentioned, sharing with you a few scenarios that I'm sure you've heard about and a few trends. But what we want to do really is having a chat with you about what implications you think these scenarios might have, either on the biopharma sector in general or on your current activity. So we'll invite you to have a chat with us. So please feel free to come off mute at that time. I will post things in the chat. So that was the plan for today. I'll move us to that second part straight, which is how we think about the future. And again, because I can't see my screen, I'll go through it, but please feel free to interrupt me with questions. I don't want this to be like complete like show and tell and talking at you. So if you have any questions or thoughts that are popping up, please feel free to jump in or share in the chat and we'll discuss. So as I said, we're a team of designers, and usually when we have a brief around, can you reimagine that product or service for us? Can you show us what sort of is the way to innovate on that specific product and service? We usually look at what happens, what might happen in the future. And the first step when we're doing this is basically sensing and scanning for specific signals, cues, projections about the future and how a trend might develop. So it's both looking at classic, numbers and projections, like how much we could invest, how much people are investing in certain technologies, for example. But it's also pretty much about looking at quantitative things, such as doing interviews with experts. And we're part of that huge network that UI is, with people who worked in many different industries. So it's also talking about to people, also talking to customers and their specific feelings about how something might develop. So we kind of do that exploration, but then before, I guess, taking a trend or an observation to action straight, we go through that step, which is creating scenarios to, I guess, stretch out a thinking about trends and sort of understand future implications. We usually do that. I mean, it's a bit of a thing we do every day, but it's about asking right questions around like, what if this technology was doing this, or what if this was developing in that way, and creating sort of scenarios about the future. And these scenarios are both to kind of steer conversation about what a role would a client would want to play in the future, but also kind of crafting, okay, if we want to have that role, that ambition, what's the preferable scenario that we want to create or be part of? So it's kind of going both ways. And we do that through a series of tools and methods, like speculative design, prototyping, and bringing those scenarios to life visually as well. And lastly, I guess quite naturally, we sort of backcast to the present and decide on the first steps or actions that we want to put in place. And that can be both like a big innovation strategy and looking at that quite globally, but also just very simply, what sort of product or service should we prototype and test and develop? So that's quite theoretical. So I just wanted to give you an example. If you look at, it's quite a very specific example. If you look at like 3D printing, for example, we know this is a technology that is improving quite quickly, and it's projected to grow, I think, about like 25% over the next 10 years. And we already know there is like 4D printing, so next generation of 3D printing, to create those like sort of anamorphous kind of shapes. So it's a technology, we know it is growing, right? But what do we do with that? What's the implication? And say I was working for like a pharmacy, well, you could say, well, what if, I don't know, in 10, 20 years, pharmacists could have 3D printers in their pharmacies and actually create medicines directly on the go for patients. What would that mean for the role of a pharmacist? Does that mean they would need to like diagnose, be like trained at using 3D printers? what does that mean for the business model of biopharma companies? Does that mean, well, you can't really sell medicine because people could create it on the go, and how do you diversify in that? What could be the challenge in that situation? So it's just the type of questions we might be asking. And then, well, this is an actual photo from a workshop. We did that exercise for a bank, but then you kind of go back to the present and like, okay, what are the new service or product propositions that we might develop based on these observations, or what should be our strategy? What do we need to be aware of? So the whole goal is creating that rich picture of what the future might be to then sort of better inform the actions of today and the strategy we're taking. So that's what we do usually for clients. And I wanted to share examples of how we did that for a huge pharmacy in the UK. So the brief they gave to us was, can you sort of reimagine our prescription service, especially the online part of the service, so that we give a more seamless experience to patients? And so obviously we did a little bit of research with patients and actual customers, but because it was about reimagining it from scratch, we kind of looked at what could how would the pharmacy be affected in the future? What are the healthcare trends we need to be aware of? How consumers or customers, using new technologies and taking care of themselves and looking after their health. We kind of looked at all of that and did a few workshops with clients, and also sort of put them in that position of like, okay, you need to think, what about we're in 2026? Like, all of these things might happen. Like, what role do you want to play in that scenario? What ambition do you have? And sort of like putting them in that future, future thinking kind of mindset, I guess. And then we did something which I think was super rich and like bring up those conversations, but which was around imagining scenarios for their service. So we had different kinds of scenarios, such as, well, what if the pharmacy was the place to go for when you have a chronic condition and you need help to manage that condition on a day-to-day basis? Or what if the pharmacy was actually the place where you can get preventative care and get access to wellness products? So we kind of created very sort of distinct kind of scenarios and brought them to life with sort of prototypes, images, storytelling. And these are nowhere near, it's not an actual solution for the service, but it's a visual way to kind of depict a scenario and provoke a conversation around it. And, I think the consequence, or like the outcome of this kind of action was then to be, okay, there are different service propositions or directions you could take based on what you saw, based on how you reacted to those scenarios, but also based on, what investment and like revenue you could get from different options. What service proposition should we go for? And then that could inform the experience and like the future state journey. So yeah, that's a method that we used a lot with clients, especially when it's about reimagining or creating a new service. So I'll just pause there before we go into a more of a discussion and like showing the scenarios, trends. Does anyone have any question or remark? I want to stop there because like I can't see anyone and don't want to talk for ages. I'm missing a few interesting points for questions. I can't see anyone.
I think that's okay. I think if everyone can post any questions that they have in the chat, that's probably the best way. And
sounds good.
Yeah.
I mean, please interrupt me if there is anything, and then I'll just
definitely will. Otherwise, keep moving. That sounds great.
Perfect. So now now we wanted to have a bit of a more interactive discussion, but wanted to like share with you a couple of scenarios and trends about healthcare in general. And yeah, I'm going to pause after each of these scenarios to like get reactions, but the goal is really to get your thoughts about what could be the implications for the biopharma sectors of these trends, or if it's too large, maybe specifically to your current activity or challenges. So I'll just start with sorry, it was like 4 different trends. So I guess a comment to say about these trends, they're quite related to healthcare as a general sector. Some of them more oriented to like new technologies, some of them more sort of like patients or like human patients outcome kind of related. And we've gathered them from multiple kinds of work, so both with pharmaceutical companies, but also with pharmacies, as I mentioned, or the NHS and governmental bodies. So it's kind of based on different kinds of observations. So hopefully, I'm sure a lot of them will speak to you, and you'll have come across them. So I'll just start with the first one. So I think it's something I think it's a trend that we can relate to as well, quite easily. But patients and people in general are increasingly preoccupied about their health and well-being, and as a result, increasingly acting as their own doctor, seeking information online. I'm seeing little cousins checking tips on TikTok, for example, so on social media, via health apps, or by tracking parameters through wearable to kind of self-diagnose. And yeah, and actually 71% of millennials say they're actively trying to improve their health. So it's like a preoccupation that is much bigger, potentially accelerated by COVID-19, but that we're seeing today. And I think, on one hand, I think this means patients have increased autonomy and kind of could relieve pressure on GPs and pharmacies and everything we're seeing about the NHS, and sort of can autonomously take decisions about diagnosis, for example, for minor issues. Meaning they don't necessarily need to see the healthcare providers. But actually, on the other hand, it could also mean that it's a completely new role for healthcare providers. And that role is about, helping patients break through the noise of that information. I think this quote from Matthew Taylor from the NHS is particularly compelling, is that all the diagnoses you might get from a wearable or a health app are usually quite probabilistic. So it's not something, like I've observed that, so for sure I have this illness and I need to get this treatment. Usually you're left with questions such as, what do I do with that information? If I have X% of chance to have a cancer, how do I decide how to make the right decision about my treatment? Meaning there could actually be a renewed role for healthcare providers to help sort of cut through that noise and understand how to make the best decision. And it's worth pinpointing here as well that sort of self-diagnosis trend, I feel, is not necessarily happening for everyone. So getting a wearable or being educated and aware about your health and making those right decisions is not yet accessible to everyone. And I think the role of healthcare providers also is to help educate and raise awareness among those groups that might not have access to this data and insights. And so yeah, and going back to the pharmaceutical sector, I guess, in general, I want to throw a few sort of implications or questions to you, but keen to hear from you directly. So I think this trend could actually present a challenge. If you think that the traditional model of, advertising some medications, having a direct access to a clinician or a pharmacist to sell a drug to a patient who maybe in the past was a bit more uninformed, that model is falling short, right? So that means maybe biopharma companies might need to, be present in the minds of a patient much earlier in that process of when they're searching for an information or looking for a treatment, and sort of step in their mind much earlier before they step even in a pharmacy or at the GP. So that's something that's quite interesting to discuss about. And secondly, as well, if you think about wearables and those tools to self-diagnose, is there an opportunity to certify those tools so that the data you get from a patient, if they go to a pharmacist, that you make sure this data is a bit more trustworthy than any kind of wearables? Is there an opportunity to certify those tools in a way? So yeah, it's just a couple of points, and keen to hear from you, Cara. If you have any other thoughts about that trend, it'd be great to hear from you. But otherwise, I'm just keen to pause there and hear from the group what they think about this scenario and trend.
I think we have very shy group members. I'm not really sure if that's a Monday or but I think let's keep moving through the trends, and then obviously we've got that activity at the end around the discussion. So it'd be fantastic if some people on the call could also work up some bravery to share their thoughts with us. But otherwise, I think let's present the trends and then we'll move on the discussion after that.
Even if it's in the chat, please feel free. I'll just walk through a couple of ones, and I think it will probably provoke some thoughts as we go through. So the second one is around, I guess, the collaboration between and different healthcare providers through integrated care systems. So we know like the NHS is encouraging a lot of collaborations between different healthcare providers and local governments to kind of achieve healthcare outcomes, reduce health inequalities, etc. But however, there is a barrier that needs to be lifted for that collaboration to happen more easily, which is data transmission, to enable more like fluid care transitions and enable each provider to kind of make the right decision. So if you, I guess most of you have heard about integrated care systems, or ICS, but they're essentially local networks formed by councils and professionals from the NHS to help streamline care transition for patients, but also facilitate referrals and reduce health inequalities. And they've been creating, I think, back in 2016, so it's quite, they've been creating quite like a while ago, but we're like increasingly realizing that those local networks and those sort of like local actions and targets are as important as reaching like big national targets from the NHS. However, there are still some providers, and a lot of them, who kind of have a partial access to patients' history and data, making it quite difficult when you get, for example, a patient from a hospital and you're a pharmacy, for example, to get, for example, knowing the history of like what the patient went through the hospital and like potentially modifying a treatment on the go. And that sharing of information between those providers is not yet completely fluid. And I've just put that picture on the right, which is Estonia, and you've probably heard of that example, but of Estonian e-health records. So basically patients have access to their personal health data through that electronic ID card, so can access that data whenever they want. And each healthcare provider that they see sort of like feed into that profile of records, and they can sort of like lock or unlock access to different providers, but equally a provider could access it if there is an urgent situation. So I think whilst accessing that patient's data for, if you think about a GP or a pharmacist, it represents a huge opportunity to kind of make the better decisions, and especially for pharmacists to take on more of a role to diagnose. But thinking about biopharma and pharmaceutical companies, I think this data represents a huge opportunity to both, I guess, assess the impact of a treatment on certain patients, or improve its effectiveness, potentially personalized medications, and understand a clinical pathway efficiency better. But there is obviously the caveat around that, is like how you can access this data, who is storing it, is there danger on security, etc. And EY quite recently published a study which showed that individuals are actually more likely to share the information for research purposes, but are slightly less comfortable sharing data with pharmaceutical companies and medical device manufacturers to improve the effectiveness of this product. So it's also, how do we, I guess, navigate those different perceptions about data sharing, so we can get the most out of patients while still doing that ethically and lawfully, to get the right outcome. So yeah, that was the second one. Any reaction, or should I press through? Any reaction from the chat or from anyone? Otherwise I might go through the third one and we can have that discussion towards the end.
Nothing in the chat. Oh, we have got something in the chat, but I think let's go to the third one, Raf, and then we can discuss this comment after we've gone through this.
Perfect, sounds good. So third scenario, or third trend, is about it's all about mental health in a way, but it's observing that attitudes to healthcare are shifting in general from just thinking about the illness or the disease on its own, but towards a more holistic view of healthcare. And people were observing, and it's quite clear from stats, that people are proactively spending more time not only on their purely specifically treating an illness, but also on time and money to improve their mental well-being and their mental health and well-being in general. So mental health has become increasingly bigger, well, not only accelerated by COVID-19, but if you look at stats as well, it's also sort of a consequence of having a sickness as well. So there's, well, people with chronic conditions, for example, are twice as likely to develop mental illness. In 2022, there's been, I think, an 80% increase in searches to Google for stress tracker. And when you look at the UK vs the rest of Europe, the UK is has one of the highest rate of mental illness in Europe, whether it's about anxiety or depression or other kinds of problems. And I mean, it's not even a trend, it's something we're observing and might become bigger in the future. But I think when we're observing the consequence on healthcare in general, it obviously reinforces the need to take that more holistic approach, which could materialize, if I think of the pharmacy world, which I'm quite close to, it might, result in potentially selling more wellness product services, but also how can we refer a patient more easily to a therapist quite early on and spotting some issue instead of waiting down the lines until it gets bigger. And for biopharmaceutical companies, I guess is there an opportunity to help develop those products and services related to mental well-being, obviously without having patients over consuming drugs, but what kind of services can we imagine around that, and getting closer to patients around these issues. So I'll pause now, and then there is a last one, but I want to maybe give us a chance to discuss the comment that was in chat.
Yeah, the comment was just around, are we doing this with large farm organizations? And sorry, I didn't realize that my video was off. And the answer is yes, definitely. That's the core our core group of clients really are all our top global pharma companies. And they're definitely looking, in this space around, I think there's 3 themes that we're seeing, which is how do we collaborate with global health systems in a better way through regulation and drive collaboration between academia and public health and regulation and kind of drug development. I think that's kind of the first big theme that we're seeing, and we're using these methodologies to really break down those silos and drive that collaboration. The second really big theme that we're seeing, which is sort of touched on here, is patient data, like who is going to be owning that sort of big conundrum into the future, and what does that mean for drug development, and what does that mean for, I guess, the big pharma companies in who owns that data and how they manage that. So really, really interesting challenge we're seeing with our clients at the moment. And I think the third thing that we're really seeing with all those clients that I just posted in the chat is, well, how do we shift the idea of drugs and medicine as a commodity to drugs and medicine as an experience and as a service. And I think that, we're seeing it's a very, very exciting and interesting time for life sciences, and we're seeing this huge shift, trend and transition from companies that are ultimately drug-centric to companies that are ultimately patient-centric. And I think that there's a big, misconception, and I think the farmers will kind of put their hand on their heart and sort of say, well, actually we are, we know our drugs inside and out, but do we know our patients? So that's a really interesting transformation that we're seeing across those 3 pillars of patient data, driving collaboration, and kind of driving experience. So anyway, I think just keep moving, Raf, and just if there's any questions, I'll just let you know. Otherwise keep tracking forward.
Thank you. That sounds good. I wanted to add to your point about moving to services as well, like from a general perspective, like it's a big topic with pharmaceutical companies. It's also something we're seeing with work with local governments or I mean, I've been working with pharmacies quite a lot, but it's also a general kind of questions and topic that we're seeing in healthcare, not just pharmaceutical companies. And been working with pharmacy, and they were questioning, you know, like if our job is not just to dispense medication, what sort of services can we deliver? How do we monetize it? How do we change the perception of patients that they can go to a pharmacy to get tested, vaccinated, or get even more like a bigger, I don't know, diagnosis on a minor ailment? So it's really that, it's not removing from products and creating medications, but it's like, how do we complement it, or how do we also think about services when we're delivering patient outcomes? So yeah, that's just a comment. So I'll move on to our last sort of trend or scenario. So it's based on the observation that obviously we're like attitudes towards healthcare obviously moving from sort of creative or reactive kind of an approach to be a more proactive and taking a more preventive approach to health. And it's already something, you know, that was in the government's agenda. So the Department of Health and Social Care stated that the 2020s would be a decade of proactive, predictive, and personalized prevention already in 2019. And it's something that we're seeing in the latest Helix report as well. Like it's just a change of mindset that is supported with technologies that we're moving into. And at the heart of this preventive agenda, I guess, lies data and technologies. And how we can use collective healthcare data to, I guess, predict and give the right recommendations. I think not only from a sort of community level aspect and almost, for example, predicting illnesses and pandemics at like a community level, but also how does that materialize at an individual level? Can we predict some illnesses and kind of take better decisions and prevent some stuff at like an individual patient's perspective? I think it's a really interesting trend, and it's obviously facilitated by a lot of technological development. So there is huge investment in AI, obviously, that is used not only in, you know, healthcare apps or wearables, but also at like the drug discovery kind of level. And I'm sure you're familiar with those development, but also genetic testing, increasing number of apps as well. If you count the number of apps on the App Store to like capture data and like help patients with data, it's booming. And also wearables becoming more sophisticated. And I think that capture of data is also interesting from a patient's attitude perspective, is that people are more and more willing to share, especially biometric data, if that exchange results in more personalized healthcare experience. So there's an interesting value exchange here that must happen for people to be comfortable sharing this data. So if you think about predictive medicine or personalized medicine, like I'm okay to share my data as long as I can get a really personalized recommendation or outcome on the back of it. And yeah, and taking a step back a little bit, I guess if we're thinking about the development of predictive analytics and AI, it's obviously taking place already in pharmaceutical companies, but if we extrapolate and saying, okay, in 10 years it's going to be generalized, how is that going to change the whole value chain from discovering a drug more quickly and then potentially launch it to market? Like, how is that process changing if we're developing those technologies? And I guess a second question or provocation is, if we can better predict a patient's, I don't know, response to a medication or treatment, or if we can predict an illness based on DNA screening, how does this change the way we develop and manufacture drugs within pharmaceutical companies? So there's, I guess, huge like impacts on the whole, drug development and production and go-to-market kind of process through those new predictive technologies. So yeah, I'll pause there with those big questions, but keen to have a bit of a discussion or questions, whether it's on these trends or the more methodological part of that presentation earlier. Yeah, I'll stop sharing my screen so I can see people, see the chat as well.
Who's going to be brave on a Monday morning and speak up and share their thoughts?
It doesn't have to be necessarily on these trends. If it's also about, you know, if you have more questions around that future thinking approach and like how we do it with clients, I'm very happy to share our thoughts. shy one. I think maybe someone is, Christoph, are you on? Maybe off mute? I don't know if it's to ask a question, but.
Otherwise, I think we should just move to the side with the questions. And then we can, I think, we've got enough time to actually get everyone's point of view. So yeah.
I'm curious to know as well, like what sort of thoughts does it gather from like different kinds of perspective, like depending, I don't know who is doing what in that audience, if you're developing startups in those like related to these kinds of strands, or if you're working on research, just like a general perspective. Do you do anything related to these different topics, and if so, what is it? I'm just curious.
So Alicia, just sorry, your name is right at the top. Let's roll with you. Is Alicia there? No. What about Ellen?
Oh, Alicia came off.
Hello, sorry, I'm so sorry. Hi, I'm from One Nucleus.
Hi,
Hello,
Alicia.
co-hosting
So nice
along with Jazz. Nice to meet you all. I hope everyone's enjoying the session. I think it would be really interesting to hear from those who are sort of first-hand, though, working in the industry. So they potentially would have a little bit more sort of to offer in the way of the insight. So I agree. I think if anyone is feeling brave enough, then please unmute or use the chat box or raise your hand.
Thanks, Alicia. I'm hoping we haven't got, I'm presuming it's just yourself, Alicia, and Jazz from One Nucleus. What about Ellen? Are you there? Fantastic. Can you tell us a little bit about what your master's is and how you've potentially applied some of these, innovation methodologies or what you're hoping to learn?
I'm sorry if I sound a bit hoarse. I'm a little bit under the weather
that's okay.
at the
Thanks
moment.
so much for jumping on and being brave.
Yeah, so I just completed a master's in health at Cambridge, and my research looked at reproductive technologies specifically, and how they come to operate how they do. So looking at the design process and the marketing. So I'm not particularly experienced at all in this kind of like future experimenting, and I'm looking to hopefully get a job in the industry. So I don't have any first-hand experience as of yet, but I'm eager to hear from the other people on the call.
Nice, super interesting. Maybe I think someone came off mute afterwards, but if not, like I have Amy next to you. I was just or Tim.
Hi, yeah. I'm actually from EY, same as you guys. And really interesting to hear about the talk. But I did used to work with GSK. Gosh, it was maybe 13 or 14 years ago now at this stage. And I know that whole focus on client centricity was very much at the forefront then as well. So understanding how our drugs that we were developing, so I was working in the R&D department, but how our drugs that we were developing were impacting patients who were on the clinical trials. And it's really interesting to see how that's kind of evolved into more, people who are not necessarily on clinical trials or who are just living, daily and understanding how our health is currently and how we can be doing better in terms of understanding that, I guess, which is really interesting to see how that's being progressed from a data gathering perspective from the large pharma, which I think is fascinating, really, and can lead to so many benefits, both for us and for in terms of the next developments that they're investing in, right?
I'm curious to know, like, what sort of data challenge, like more specific data challenges were you working around, and like, or part of your conversations with them?
When I was working with GSK.
Yeah, because you mentioned like data challenges, so I'm just curious to know.
Yeah, well, what I was working on was drug development but in the manufacturing space.
Okay.
So first time it was going to be manufactured at large scale. And what we were doing was manufacturing product for clinical trials, right? And so when you're working in a large scale manufacturing environment, you're in a factory, right? And so you're very far removed from somebody who's actually using what you're manufacturing. And so the objective really was to bring it to life, how important safety of the products are and how important the quality of the product is. So those specifications that maybe we were trying to reach and might get laborious or might seem a little bit futile when you're in a manufacturing space and you're trying to progress things, just to have at the real forefront of your mind the purpose for why you were developing these products and the impact that it was having on somebody's life and somebody's family. And so hearing from the patients and how much it had changed was one of the things that we used to do maybe every 5 or 6 months, was hear from the patients who were on those clinical trials and how positive an impact it was having, or maybe the challenges that they were having as part of the clinical trials, and that impacted our behavior in the manufacturing space. And that's kind of not so much data gathering focus, but behavioral focus, if I'm honest.
Yeah, that makes sense. Super interesting to on a whole chain where you have less data about what's happening down the line. How do you communicate that and sort of almost
to life
perspective, but I guess almost motivation and fulfillment as well, knowing what's happening.
Yeah, it's distinguishing it as well from maybe manufacturing toilet seats or something like that, right, where the impact on the consumer isn't as personal or directly impacting on their health, and so bringing that really to people's minds, the impact that they're having and the risk, I guess, that you're taking in terms of manufacturing.
Thank you, Amy. Thank you for sharing, and nice to meet you as well.
Yeah.
I might just go through. So I know Tim, sorry, I pointed at you, but you joined a bit late. Maybe can we get one more thought? I know from Nicola, for example. Nope.
I know Nicola had the question earlier as well.
Oh, hi, Nicola. Nice to meet you.
Hi, nice to meet you. Yeah. So I'm coming from an academic institute, so that's why I was asking these questions. I know that your clients are mainly in the pharma space. Just kind of it's really interesting to hear kind of the trends and how you do this, methodology. But yeah, I'm interested to know kind of how, as a smaller player or, as a academics, how do we kind of have a role in kind of knowing these trends and be able to kind of fit into kind of the trajectory of where this is going?
It's a really good question, and we're actually, Cara mentioned we're collaborating with academics, but we're, for example, at the moment we're working with a couple of different, design in general kind of schools. So, for example, the Royal College of Art or University of Arts of London actually work with PhD students on specific topics that might be of interest. For example, I think with UAL, we have quite a few topics around sustainability and doing experiments around local government actions and on how to raise awareness of sustainability. So it's a bit of a different topic, but just to say that we are working with universities to do these kinds of projects. And what's great as well, because we're more of a design and innovation team as well, it's both to get collaboration in terms of thought leadership and content from experts and working with universities to do that, but also to get students to work on actual design challenges that we do with clients, get them to get hands-on kind of experience, but also for us to get super cool ideas and working with great institutions. So we do work with academics for different kinds of topics that we're looking to in the future.
Well, Nicola, so nice to meet you. Thanks so much for coming along. I think academia plays a huge role in driving this collaboration of this transformation within the sector.
Mm-hmm.
And I think that, and beyond the sort of design work we do with our kind of design academics, we do a huge amount of work with our life sciences academics as well. We've just about to release a huge piece of work with the University of Oxford on I guess, the role that pharma plays in kind of aging in the aging population, and how we can help them, you know, drive a connection with the NHS. And that's been a big collaboration between Oxford and us, and also the NHS. And I believe that paper it's just about to come out. Like, I'm not sure if, I believe that's about to come out in the next couple of months. We're just about to publish that, which is exciting. But how do you, I guess I'd love to hear from you in terms of how do you, you know, because I know that our big clients are always sort of, you know, looking for ways to collaborate in a better way with the academic world. I think it's still a little bit of a challenge. There's a lot of red tape there. But how do you feel working in that space? And how do you feel, what do you feel needs to change, particularly from a big pharma side, to kind of collaborate and innovate more?
Yeah, so that's a really quick question. So I'll give you a bit more background on kind of our institute. So I'm from the Earlham Institute. So we are based in Norwich. We are a BBSRC funded research institute that works on bridging the gap between genomics and kind of data and biology. So kind of what you're talking about in terms of DNA sequencing and predictive stuff, that is the kind of thing that we're working on. So we do have interactions with a lot of kind of big pharmas as well. So our research institute not just do kind of research-based kind of faculty side, but we also have external facing kind of unit, you can say, but it's kind of all for the UK community to access kind of expertise and kind of our facility. So a lot of the interactions with pharma at the moment, it's kind of based on what their needs are, that they know that, you know, we exist and we do this sort of thing, and they come in and ask for inquiry. But it's very much kind of specific to like something that they want, say like they want a certain like sequencing to be done, or they want to have this particular piece of work. But it'll be good to kind of open that conversation up a bit more to find out more strategically, you know, apart from this one thing that they asked about, what are the bigger picture, to see how we can help beyond, you know, what that one thing that they know we can do already, because there's so much more like research that we're doing at the moment that, you know, we might not be have access to, partly because of, you know, the teams that are kind of coming to us. It's a very, you know, a defined team that they want a specific thing, but how do we open up that conversation to the wider, you know, organization within pharma, that we can have that interaction to see how we can have more kind of connection points.
And what do you think is the main challenge to, on kind of having those connection points?
I guess partly is, understanding kind of the structure as well of, you know, different companies is different as well. To kind of know who will be the person that you could kind of talk to, and also, I guess, you know, be engaged with teams like yourselves to know, you know, if they are kind of outsourcing on working on certain things, on trends, say that you are interested in looking at how, you know, DNA sequencing can predict a health condition. Like, how do you go about finding relevant academics who are working on this field that you can engage with? And stuff like that. Kind of like, I guess it doesn't necessarily have to come directly from these big companies, but knowing who is actually working on these field and actually researching and kind of engage that way, and therefore kind of build that circle, or kind of rounding that circle, to make sure that, you know, different players who are already working in this field are involved at an early stage. But I don't know how it works at the moment for you, but I'll be interesting to kind of hear more about that.
Makes sense. That's super interesting. I mean, one point that I thought, Alicia, you had your hands up, so keen to hear your response as well if you want to answer that question. But I think when it comes to like futures as well, and exploring future trends, like a lot of different actors might be doing it in different ways through different lenses, whether it's like consultancies or academics or big companies, and it you know, often hard to pinpoint like who has the right voice and like what's the right collaboration around it. But I think being on those events and like creating connections like we're doing right now is a super cool opportunity. But Alicia, did you want to?
Yeah, sorry, thank you. I think, it's a really interesting sort of thread of the conversation we're on now. I think especially when we talk about sustainability, how we can make the industry more collaborative when it comes to sort of sharing data, etc., and access is a really interesting thing to explore. But there are quite a few challenges, so maybe exploring what those challenges are and then the solutions is a way forward, because I think definitely the future of us making sort of advances and leaps is around a collaborative ecosystem. And there are so many angles we can take to discuss in terms of what makes a great collaborative ecosystem. How do you best sort of build those pathways? What are the best components? But then what are the challenges when it comes to stuff, I guess, like barriers between different types of sectors that are collaborating, or privacy concerns, or ethics even. That's an interesting one. So it's a really big space. So yeah, the discussion could probably take many different directions, but yeah, I just wanted to sort of, now that we've got some sort of insights from those firsthand working in the industry, it's really great to kind of see what's front of mind for people and where people are. And if and anyone else on the call just wants to sort of say who they are, what they're doing as well, that could, you never know where that could take the conversation. Thank you.
Thank you, Alicia. Well, I think looking at the panel, we've probably gone through everyone. But I mean, if everyone wants to jump in for a last sort of comment, please do. But I think otherwise, I mean, I think it was a really good, interesting conversation for a Monday morning and quite inspiring. So thank you all for, joining the call and like being brave and switching off your camera and mentioning what you were doing.
Yeah, thanks, Ellen and Nicola, and Amy. We might wrap it up there, and I think we'll share the materials around. I don't know, Jazz and Alicia, if that's what we'll be doing, and hopefully gives you a bit of food for thought for your Monday morning.
Cool.
Thanks, guys.
Have a great week. Enjoy the rest of the
You too.
conference.
Thank you, everyone.
See you
Bye.
later. Bye.
Just to say, we'll be back at 11:30 for our next innovation showcase. So it'd be great to see you there. And in the meantime, please enjoy and familiarize yourself with the app. If you haven't already, please go ahead and vote for our Bio News Round Award. And I hope you enjoy the rest of the conference. Thank you.